for me personally, there's a few key messages coming out in terms of improving maternity service. First, outstanding care is possible, even very challenging contexts. We had two fantastic stories on how that can be done. And secondly, variation is not inevitable. Some services have found ways of working and leading using their data. So data does have a very important point. And the third point is, how do we move emotions and think objectively about what needs to be done? So brilliant. Thank you all very much. But if I can just move on to some questions, and there's quite a lot of questions, and perhaps, Andy, if I can start with you. And in terms of one of the questions around your project, your transformation, moving to a sustainability phase in terms of the maternity safety and support program. Questions: what are the 2 or 3 risks that keep you awake at night about sustaining and keeping that up in terms of gains?
Yeah, I saw that question come in, and I've been thinking, is this what keeps me awake at night at the moment, given everything else that's sort of going on? And actually, we've got really good local leaders in our maternity services, and I think I can sleep better because I know that they know that they can and should talk to me whenever they see any concerns or sort of red lights flashing. So I think when there's that trust between local leadership and executive leadership, and it kind of goes to some of the questions around psychological safety, which is, if you're in a world where the exec team is perceived as not wanting to hear bad news, I think that's one of the things that can close down a sort of a service. So if I talked about our not being able to get access to elective cesarean section theatres. Well, there's a world where we could just say, oh, you just go away and sort that out. It's not a problem. Well, but we talk about it a lot, and we know we're not resolving it because it's a really wicked issue with all of the other challenges and demands on theatre. But that trust is there. So I think it's about having a really good local leadership team that know that that you've got their back. I think workforce stability has helped. So by reducing that demand on agency and temporary staffing, if you've got a workforce who you're training, you can start to get consistency. And so, they know how you do stuff around here. I think there was a question around culture change can sound abstract. Well, culture is just how stuff gets done around here. And if you want to be really advanced on it, it's how stuff gets done around here when no one's watching. And so actually, by reducing your demand on temporary staffing, having a team that can train together and kind of everyone agrees on the way things should be done, I think you can take a bit more comfort in that work happening. And then you need really good governance discipline. So I think one of the big changes in maternity services over my professional career is sort of bringing it into the world of normalized governance in the way that it perhaps took a while to get to. But make sure your structures are there in terms of, have you got good levels of incident reporting? Are you seeing high levels of low or no harm, which shows a healthy reporting culture? Are you feeding those, are you closing those feedback loops? And I think it's just sense checking all of that means that you perhaps get a slightly better night's sleep than you otherwise might.
Thank you, Andy. And I love your point about feedback loops and thinking, improving, and incremental changes as well. I think that's brilliant. Kim, I'm just wondering, from you shared a really passionate and inspiring story, and I'm wondering, in terms of answering the question around sustaining the improvements, I'd love to kind of hear your perspective on that as well.
I think I think what Andy said is really important. You have to trust your leaders that are in place to know how to run the service, and you have to be able to. Often what we hear is that's what the data says, but in our professional opinion or clinical opinion, and then we all dive down into trying to dissect data, and then we lose the point of actually why we're around the table. I think you can never be complacent either. Good teams will have not so great days, but it's how you support them. And as Andy says, that if they know that you've got their back, you encourage and you role model that actually there will be bad days, but you're all in it together. But the most important thing is, what do you learn from that? How do you support the team to get through that? And most importantly, where is that co-collaboration? I was trying to think, and Kate and I were talking, we're 8 years down, and often I hear, well, Kim, you can just pick that up and put that in the medical wards now. It's not going to happen overnight, and we're still on that journey, but it's taking things like the Wellbeing app, it's taking champions from maternity out and sharing. That's what keeps it sustainable. And at the moment, I've got my associate director for mental health services and our director of midwifery looking at the commonalities in what's coming out of the national reports, because often that's where the closed cultures can come from, because people are too scared. Or, I always say this question might be stupid, but I'm going to ask it anyway. What is X, Y, and Z? But if you don't do that, you're taking, it's not that anyone's come to do a bad job, but sometimes people also lose their way and they're so overwhelmed. It's about trying to get what's in front of them done in a safe manner. So actually, it's really brought maternity and mental health services together, and they're already mental health are looking at sharing the trauma-informed care learning to the midwives and bringing them together. So it's not just that sustainability, it's that sharing, and they're learning from each other. It's not coming from board, it's not top down. We're giving them that space to experiment. And yes, they won't always get it right, but we're there to support them. And most importantly, that collaboration with the Maternity and Neonatal Voices Partnership to make sure everyone I speak to expects a good clinical service. Actually, it's often the silly things like, I got the wrong breakfast. But if you're getting the wrong breakfast, actually, are you listening to me at all? What happens if I have a problem? Are you going to deal with that? So it's just going back round and having that professional curiosity.
That's really well put, Kim, in terms of professional curiosity, balancing gut reaction, professionalism, and also data, and doing the constant triangulation with that. No, brilliant. Actually, you answered a couple of other questions as you were just responding to that, Kim. So thank you very much, Kate. Just one last question for you. There is a question around where we go. If you could only bring 3 metrics on a single slide to a maternity board discussion, what would they be and why?
So I'm going to cheat a little bit. My metrics might have sub-metrics, if that's okay. The first would be around outcomes, so stillbirths, mortality. The data that Mark presented is much more contemporaneous than any of the data we get nationally. So being able to look at data that tells you about your service would be the first thing. Sorry, my little cheat on the sub bit for that is where outcomes weren't optimised. So where there are near misses or low harm, not just harm, but where there are lessons to be learned that could affect a change in a pathway that could make the outcomes better for other babies and for other women. Complaints and user feedback. So in terms of canaries in mind and people telling you way before anybody else notices what's going on, complaints are a gift. User feedback is so important. And if we had Kaiser here, they'd be saying the Net Promoter Score is one of the few metrics that people should actively be looking at, because it tells you about what it's like to experience the service. And then the third metric I'd have would be around staff retention. And the reason for that, I don't know if those that you are on LinkedIn, somebody's posted an iceberg of toxic culture with all nasty stuff below the surface. But what you notice is people leaving and focusing on the exit interview misses the point. Why do people not want to work in your service? That would be the thing that I would want our board to be focusing on. Those 3 things: outcomes, are we providing a fantastic service? Are people telling us that they experience it as fantastic? And does anybody want to work with us?
Brilliant, Kate. Great list there. And of course, SMI, I'll add to the list as well in terms of improvement. No, brilliant. Thank you very much. Can I just, we are got a few minutes left, and I'd like to kind of go through a few last points before we conclude the webinar. But before we do that, if I can just ask each speaker to 20 seconds, 30 seconds to answer this question. What is the one thing you would urge every leader to do when they leave this webinar in order to make that change needed to transform maternity services? So if I may start, Kate, with yourself first.
Wow, that's a bit of a hospital pass. So I think I would say try and find a way so that people know that you really are able to listen, and that once you've heard somebody's story, you're going to do something about it, because otherwise nobody will tell you anything. And if they do, they'll just expect that nothing will happen.
Brilliant, thank you. Kim.
I'm giving it some thought. I think I'd read. I would go away. I would read a recent experience, and then I would go and walk that floor and just be there. Just ask people, how's their day? What keeps them awake at night? And what do they think that could be done differently, and how would you support them to do that?
Brilliant. Thank you. And just going around, Andy.
Well, Kim sort of took mine. So I'm a big believer in data, mark and name, and I think this has the ability to be transformational. There is the question about when the data and your gut disagree, what's your personal rule of thumb? So I will always go after the anecdote if it's different to the data, because it probably means someone's presenting the data in the wrong way. So pull the thread on the anecdote. So I would say to people, go and look at your data, look at something that doesn't feel right, and then go and walk the floor and ask the question, because the dashboard will give you the direction you should look in. Then you've got to really go and poke it with a stick yourself. So leadership for me here is a contact sport. You can't do it from a screen. The screen will give you the area, then you've got to go and ask questions. And if I can just sort of take a final observation on what Kate said earlier, we've got to get much better at looking at other data sources that aren't traditional. So Mumsnet will review your maternity services for you, and you might not like it, but that's where the honest feedback is going. And it will name some of your staff, and that might feel unfair, but that's anecdote that you should go and pull a thread on as well. So get those data sources, obviously have your SMI up front and central, but triangulate. I often think my job is as the chief triangulation officer in the organisation. I should just be sense checking, how does all this sit together day to day.
Thank you, Andy. And I did try to get Mumsnet on the webinar, but I failed miserably. Mark.
Thank you. Well, Andy's was a perfect tee up for mine, and I wasn't going to say just use the SMI, but what Andy was getting at there and explaining very well is the important thing is you ask why. So to that question of when the data doesn't match your gut, my response would be great. Why? You don't necessarily assume that either is right. I mean, the gut is probably more likely, but the thing we need more of across the maternity services is people saying why and really getting into it. And I think just developing that curiosity, and there was another question around what's stopping trust taking on the same type of analysis. There's a lack of curiosity. I think there is some concern around, this topic more generally. It is very sensitive. It can be very political. You can get an awful lot wrong. I know I make loads of mistakes, but mistakes are the privilege of the active, right? Go in there, ask why, try and change things, see what's happening as a result of that, learn and improve. So that it's just that continual curiosity and why is so important if we're going to improve maternity services generally across the country.
Thank you, Mark. That's really, really insightful. And Kate.
So I just wanted to make a last point around turning rocks over. So when I first arrived in Cornwall, one of my colleagues said, if you carry on turning rocks over the way you are, you'll keep finding things that are wrong. You need to stop, and then there won't be anything else to address. Now, one of the issues I've got is for as long as you turn a rock over, there is something that you need to address. You need to keep turning. And that gut response thing to me, it's a learned response. It's a muscle memory to when something went wrong or happened in the past. We should always listen to those and keep turning rocks over until we find what it is that people are feeling within their context. They know way more about this than we do.
No, thank you, Kate. And thank you to all the speakers, and thank you for all the listeners and participants in the webinar. There's a lot of content, and we've been through quite a bit of a journey in terms of sharing stories, talking about data, and some key themes really coming out in terms of curiosity, having conversations, asking the difficult questions. But the key thing is, it can be done. We can improve the services. We shouldn't take what we have today as the status quo. We can improve outcomes of mothers and babies. So once again, thank you all for joining us today. There is if I can remind, please prompt you, there is a feedback survey. It only takes 2 minutes for you to complete. So do please complete that for helping us shape future events and understand, more importantly, what topics you'd like to discuss. And also, thank you all for asking the questions. There'll be a follow-up, and those who've missed the webinar, there's the opportunity to kind of watch all these conversations and go to the content again on the webpage. We'll soon publish that over the next few days. And of course, just as a reminder that we do have a newsletter, which is a great source of learning and development for healthcare leaders. And lastly, we do have our next webinar, which will be on escaping the NHS perma-crisis, which will be on 3rd of March. And we all look forward to seeing you there. So once again, thank you all, and see you soon.